When we get more proactive in intervention and we start to radiograph these cats and we say, aha, this cat is already showing signs of osteoarthritis. Michael, what are our options for treatment and management of these cats?
When we treat a cat with osteoarthritis, it's exactly the same way that we would treat a dog with osteoarthritis. We're talking about multimodal management. We're talking about making use of nonsteroidal anti-inflammatory drugs as needed for pain. Now, we're kind of limited with our nonsteroidals that we have that are approved for use in cats, but they still can be used on an as-needed basis. Looking at joint supplements, glucosamine and chondroitin sulfate supplements. You're looking at omega-3 fatty acids for a kitty. I'm a big believer in both of those. And owners don't always necessarily notice a difference until they take them off, and all of a sudden, they seem different. Looking at weight management and exercise. Those two always go hand in hand. And for me, weight management is by far the most important component of the multimodal management that we deal with. We need to make sure these kitties are getting exercise. We do a lot of physical therapy and rehab here at Mississippi State for animals that are overweight or with chronic osteoarthritis to try to improve range of motion of their joints and try to stretch out any muscles that may have developed some contracture due to decreased use, and work on weight management for these kitties. Now, I don't want to deprive the kitties of their meals, but there are some very palatable diets. Hills has some very palatable diets, especially for cats, for weight management, and I think those are valuable. So again, the whole multimodal management picture for cats is exactly the same thing that we do with dogs.
This definitely makes sense.